this is Dr. Russell Foulk at the Nevada Center for Reproductive Medicine. Today's subject we're going to address is a topic called unexplained infertility. And the reason we're talking about it is it often invokes a lot of questions in patients. A lot of people think that if they've been diagnosed with unexplained infertility, there's no reason for their infertility. But of course that's not true. If there is no reason, then they would be fertile. So the definition of unexplained infertility simply means that if you look at all the reasons for infertility and can't find the reason, it's called unexplained. There's still a reason, it's just not explained by the common test that you do for infertility. So let's go through that for a minute. The common reasons for infertility are related to one of three things. It has to do with either something wrong with the sperm, something wrong with the eggs, or something wrong with the uterus. So we commonly test those by doing tests on the sperm called the semen analysis, tests on the eggs like hormones and cycle control, and tests of the uterus and the tubes called the hysterosalpingogram. In about 20% of couples, all three of those things look completely normal, yet they're still suffering from infertility. That's called unexplained infertility. Again, it means that you can't explain it, but there's still an explanation. You just have to dig a little deeper. So the way you manage it is you say, well, if we know there's an egg, we know there's a sperm, we know there's a uterus, then it's just a matter of them functionally coming together. So it's a dysfunctional problem of those three components. So what we do is we help those processes along and isolate where the problems could lie. For example, if we think that one cause of unexplained infertility is that the sperm can't swim well through the cervix, as an example, then we simply put the sperm past that point. That's called an intrauterine insemination. If we think the problem lies with the function of the fallopian tubes, then we'll put the sperm inside the fallopian tube and make sure that there's an egg on the outside of the fallopian tube so that the only thing we rely on now is the function of the fallopian tube. If we think the tube is working, then patients get pregnant. If a patient doesn't get pregnant, we know the cause is the fallopian tube. A very common reason for this, for example, is endometriosis. That's one of the more common reasons for unexplained infertility because it's an inflammatory condition in the pelvis that can compromise tubal function. If the tubes are unable to pick up eggs, for example, they might be opened by a dye test, but they're unable to bring the egg and the sperm together. So when you define the tube and isolate it as a functional unit, then you'll know if that's the true cause of the infertility. If the tube is not working, then doing inseminations are not going to work because the insemination relies on the tube to bring the egg and the sperm together. So in that situation, you move on to something like in vitro fertilization or surgery to try to fix that tube. But the most important thing with unexplained infertility is to understand that there is an explanation. It's just a matter of how deep you look and how you define the processes to find where that reason is. The great news about unexplained infertility is it's extremely treatable because depending on where the problems lie, there's a step for every dysfunction. As I mentioned, if there's an issue with the cervix and you bypass the cervix, then you're going to get pregnant. If there's an issue with the tubes and you bypass the tubes, then you're going to get pregnant. So every cause of unexplained infertility is treatable, except for a few, such as if eggs are unhealthy. So if a healthy 45-year-old woman comes in, everything looks normal, but she's not getting pregnant, it could be because the eggs are no longer healthy. She may not be able to get pregnant if she doesn't have healthy eggs unless she uses eggs from somewhere else. So there is a treatment for it, but it might require some sacrifice to achieve that. But again, the most important thing to remember is there's an explanation for every cause of infertility. So search out what that cause is and make sure you understand it. Ask your doctor for the reason for your infertility and make sure you're treating it appropriately. And once you do, everyone succeeds. So that's the most important thing to understand about a very vague and hard to understand condition, to know that it's treatable and it is explainable despite its title. And as long as you approach it with the right group of physicians and treating practitioners, you're going to succeed. If you have any questions, give our office a holler or call our office at the Nevada Center for Reproductive Medicine. We'll be happy to help you through it.